Good morning, good afternoon, and good evening, everyone, to the Honorable Dr. Ayu Alit Widhiartini, APT, Magister Science as Block Coordinator, Dr. Wayan Sumardika, Master of Medical Education, Ph.D, as Evaluator, and Dr. Ketut Widyastuti, Specialist Saraf Consultant, as Facilitator. In this video, SGD B4 will make a presentation about medication of type 2 diabetes mellitus in geriatrics. So this is the member of SGD B4. Next slide. And this is the overview of our presentation. Next slide.
My name is Anggiamanda Triana Devi with last 3 digit of student ID number is 088. Chapter 1 Introduction. Next. Type 2 diabetes is a chronic and progressive disease caused by insulin deficiency because of pancreatic insulin resistance and beta cell dysfunction in target organs. The prevalence of this disease will increase with aging. It is estimated that 1 of 4 of 2 billion elderly in 2050 will have diabetes. The heterogeneity of individual functional status in elderly makes it hard for the management of diabetes treatment. When setting treatment target, functional limitation and comorbid disease should be considered carefully. The reduced insulin secretion and deficiency in beta cell function in type 2 diabetes mellitus can alter the effectiveness of pharmacotherapy. Other than that, more than 50% cases of inappropriate drug prescription happen to older patients with diabetes. That's why choosing the right drugs and medication for elderly patients with type 2 diabetes mellitus is really important. By knowing and choosing the right medications, effective treatment for geriatric with type 2 diabetes mellitus can be done. The problem formulation are what is the definition and epidemiology of type 2 diabetes mellitus, what is the pathogenesis of type 2 diabetes mellitus, what are the risk factors and prognosis of type 2 diabetes mellitus, what are the drugs and medication used for type 2 diabetes mellitus in geriatrics, what is the adherence to medication of type 2 diabetes mellitus in geriatrics. Next. The purpose for these student projects are knowing about definition and epidemiology, pathogenesis, risk factor and prognosis, drug and medication, and adherence to type 2 diabetes mellitus. While the benefit are able to know about definition and epidemiology, pathogenesis, risk factor and prognosis, drugs and medication, and adherence to type 2 diabetes mellitus. Next.
Hello, my name is Azam Roswatla with last 3 digits student ID number 094. I will continue the presentation next. First, I will explain about the definition of diabetes mellitus type 2. According to World Health Organization, diabetes mellitus is a chronic metabolic disease marked by an increase in blood glucose level, which over time causes damage to the heart, blood vessel, eyes, kidneys, and nerves. Most cases of diabetes mellitus are type 2 diabetes mellitus with a number of more than 90% of cases. Type 2 diabetes mellitus has been referred as non-insulin dependent diabetes for a long time, but in the past decade, the key problem for type 2 diabetes mellitus characterized by progressive loss of beta cell insulin secretion, inadequate compensatory insulin secretion response, and tissue insulin resistance. Disease progression makes insulin secretion inadequate to maintain glucose homeostasis, leading to hyperglycemia. Patients with type 2 diabetes mellitus are mostly characterized as obese or have a higher percentage of body fat, particularly in abdominal area.
My name is Anet Malinda. My last 3 digit numbers is 092. I will explain about the epidemiology. Diabetes is one of the most common degenerative diseases in the world. Currently, diabetes has become a serious threat to global health. Judging from the latest data from the International Diabetes Federation 2019, as many as 463 million people in the world, and this number is increasing when compared to the IDF 2017 data, which show the number of 425 million people and is estimated to continue to increase to 578 million people in 2030 and 700 million people in 2045. Indonesia, as one of the countries with the largest number of diabetes mellitus sufferers in the world, has problem in reducing the incidence of diabetes mellitus. Indonesia has a vigilant status because it's ranked 7 out of 10 countries with the highest number of diabetes patients. The number of diabetes mellitus cases in Indonesia continues to increase every year. IDF data shows an increase in the number of cases from 10.3 million sufferers in 2017 to 10.7 million sufferers in 2019 and is estimated to increase every year. In line with this, risk assessment data shows an increase in the prevalence of rate of diabetes in Indonesia based on doctor diagnosis of age in aged 15 years and above in 2013 by 1.5% to 2% in 2018.
My name is Theodore with my three last digit number 093. So the pathogenesis about diabetes mellitus type 2 started when our body experiences insulin resistance. This action makes some interference from the normal body function. All of this activity might cause the unhealthy lifestyle from overeating, obesity, inactivity, and etc. The lifestyle that causes intraperitoneal accumulates visceral fats or abdominal fats, and this way endocrine organs secretes more adipokines, free fatty acid, and inflammatory mediators. FFA, or free fatty acid, makes lipotoxicity that confirm the inhibits of GLUT2 that transport glucose in beta cells of pancreas islets and hepatocytes. When the beta cells can't define the glucose or blood sugar, makes the insulin production drops and affected the insulin resistance. Insulin resistance may cause relative insulin deficiency and makes absolute insulin deficit. Both of these actions may cause to hyperglycemia. Otherwise, the insulin resistance also may cause by the few things such as genetic factors, aging factors, a lot of medication such as corticosteroids, antipsychotics, highly active and antiretroviral, and progressing only oral contraceptives.
Okay, so I will continue the presentation. Hello, my name is Christian Salomo Parasian Sinaga with three-digit last. My student number is 096. So the occurrence of the insulin resistance makes relative insulin deficiency and absolute insulin deficit. Both makes hyperglycemia that toxic for the beta cells. And also the insulin resistance limit the energetic supply and further might give impaired cardiac functions that leads to the heart failure. Next slide.
Hello, my name is Divin Lufianto and my last digit of my pseudo number ID is 09Y. I will continue about the risk factor of type 2 diabetes. First, they have risk for having a type 2 diabetes if they have pre-diabetes. It is a condition in which blood sugar level is higher than normal, but it is not high enough yet to be diagnosed as type 2 diabetes. And then overweight or obese, 45 years or older. This is because of impaired pancreatic islet function due to aging. And then family history with type 2 diabetes, rarely having an exercise or physically passive, have had gestational diabetes or given birth to a baby which weight more than 4 kilograms, low level of high density lipoprotein or HDL, certain races such as African American, Latino American, American Indian, Alaska Native, Native Hawaiian, and Pacific Islander. And the last is if the person have insulin resistance.
Good evening, good morning, and good afternoon. My name is Anastasia Gret Roslin, and my last three student digit number is 089. And now I'm going to explain about the prognosis. Diabetes is a complex condition, so doctor may not predict life expectancy. Report in 2010 on United Kingdom states that on average, type 1 diabetes life expectancy is reduced up to 20 years, and for type 2 diabetes is reduced up to 10 years. According to CDC in 2002, around 25 people in every 100,000 died by causes related to diabetes. By 2014, the same figure fell to about 21 people in every 100,000, and in 2016, around 24.8 people in every 100,000 died. The range of estimated life expectancy is wide, depending on the person's age, lifestyle factors, and treatments. The rest of it will be explained by my friends.
Okay, I will continue the presentation. My name is Putra Arjuna Satistiawan with last three-digit student ID number 097. So I will explain about the drugs and medication that often used for type 2 diabetes mellitus in geriatrics. As we get older, the higher risk of comorbidity, we have the higher risk of comorbidity and complication. And the most common comorbid condition in type 2 diabetes mellitus is cardiovascular disease. And in elderly patient, it's common to use about 3 times more medication than the younger patient. So the elderly patient have a higher risk of experiencing drug-related problems, especially in elderly patient with type 2 diabetes mellitus. And the presence of aging can accelerate the occurrence of diabetes-related complication, as well as affect the clinical presentation of diabetes, change the pharmacokinetics of the drugs,
and thus requiring the P drugs and proper dosing, whether it is using oral or insulin. So the high number of drug use by elderly patients and the combination of various drugs will contribute significantly to the high prevalence of potential drug-to-drug impact, or DDI. The most commonly reported interaction include metformin with metoprolol, metformin with rabeprazole, and insulin with metformin, etc. And in prescribing oral antidiabetic drugs, it's necessary to pay attention to the proper administration of the dose because the right dose will determine the success of treatment in the patient. And the therapies must be focused on the patient needs and also reduce the cardiovascular risk. There are several types of the therapy that used by elderly. The first one is insulin therapy. Insulin therapy is mainly given when the patient have a poor glycemic control condition, when the HbA1c levels more than 9%, FPG levels more than 250 milligrams, and random glucose values more than 300 milligrams per dl, or patient with ketourinuria. And compared to the oral glucose lowering drugs, are less likely to have a possible cause of death, CVD, or severe hypoglycemic when compared to insulin. Second is metformin. Metformin works to lower blood glucose levels by inhibit the glucogenesis by the liver and contracting glucagon action. Metformin is considered the safest drugs that used by the patient with renal impairment. The third is sulfonylureas. Sulfonylureas is the oldest class of oral antihyperglycemic drugs, and this class has agents that induce the secretion of insulin.
Okay, my name is Yosefina Grasataji with the last digit student ID number 087. Okay, I will continue presentation. The leading ions. TZDs are agonists of the peroxisome proliferator activated receptor gamma, which activated specific gene subset, increases peripheral insulin sensitivity, and provides glucose production at the hepatic level. However, the use of thiazolidinediones is not recommended for patients at risk of congestive heart failure. The next one is GLP-1 receptor agonist. The agonist of the glucagon-like peptide GLP-1 are protein that act on pancreatic islets, promoting glucose-dependent insulin release from the beta cells and inhibiting glucagon secretion from the alpha cell. Nausea and diarrhea and also weight loss may also be present, and therefore these drugs may be not advisable from older patients, particularly those suffering from malnutrition and cachexia. The next is DPP4 inhibitors. The DPP4 inhibitors like allogliptin, linagliptin, sasagliptin, sitagliptin, and filagliptin have been developed as effective drugs reducing blood glucose in patients with diabetes. Studies performed in adults with diabetes established the efficacy and safety of DPP4 inhibitors with minimal hypoglycemic events, no risk of fractures, and neutral or even reduced risk of severe complication and mortality. And last one is CGLT2 inhibitors. Anti-hyperglycemic agents of this class are canagliflozin, dapagliflozin, and empagliflozin. These drugs have demonstrated efficacy, tolerability, and favorable safety outcome. The main side effect of using CGLT2 inhibitor agents is generally a mild genital infection. The side effect was more common in female patients and in subjects with previous genital infection.
My name is Felix. My last three digit is 099. I will continue the presentation regarding the adherence to the medication in type 2 diabetes, especially in elderly or geriatrics. One of the things that is included in consideration when giving some types of medication to geriatrics is adherence. Adherence, by definition, means patient obedience toward types of medication which can be given or taken. Patient adherence can be affected by patient disobedience, which can happen in various forms, such as difficulty adhering to their self-medication, a sudden medication cessation, or misuse of drugs. Patient disobedience can be also influenced whether type 2 diabetes mellitus complication can occur or not. There are also factors that can cause disobedience in especially type 2 diabetes medication. So I will discuss regarding the factors. First, a patient doesn't understand how to use the drugs. Management of diabetes is require considerable knowledge, including understanding of the disease on the body, the treatment, and the side effect of not taking the drugs. In geriatric patient, self-motivation are usually not enough to improve patient adherence. Understanding toward the medication usually considerably hard to achieve in geriatric patient, especially because they lack any literacy or general knowledge about the medicine. Second, regarding patient discomfort about the polypharmacy. There are some types of patient that might feel discomfort toward types or numbers of medication that they require to bring or consume on daily basis. There are patients which can feel disturbed when they need to bring many types of drug in number or types while they are doing their own daily activities, which is the side effect is the more you give the drugs, the more patient feel the discomfort. The third factors is regarding patient forgetfulness to take or use the drugs. In geriatric patient, usually is characterized with forgetfulness, so they can be forget to take their own medication, which is some kind of form of disobedience. This usually happen with a patient with many daily business or are on to go to forget to bring their own medication.
Okay, my name is Putu Yudhistira Kawardana with 3 last digit student ID number is 098. I'm going to continue my friend's explanation about medication adherence. So the next point is patient feels better without drugs. In this point, patient beliefs about illness and treatment can be a huge factor toward obedience toward the treatment. Some patients believe by discontinuing the medication might be the best option for their disease, while discontinuing the medication, we know, of course, it can be fatal to the patient health if without doctor advice. So therefore, the doctor should give clear information about patient medication. The next point is patient feels worse after consuming the drug. This can be happen due to drug side effect, like some of anti-diabetic drug like metformin and glimepiride cause flatulence and diarrhea, especially about stopping medication without doctor advice. And as addition, beside of the factor that influence patient adherence, there are also ways to improve medication adherence, such as health literacy, patient monitoring, etc. But I think the most emphasized way is health literacy. Health literacy is cognitive and social skill that influence both patient motivation and individual capability to understand and implement it.
My name is Alamanda Chandra with last 3 digit student ID number 086, and I'll continue the chapter 3 conclusion. The conclusion of our presentation is the key problem for type 2 diabetes mellitus is characterized by progressive loss of beta cells, insulin secretion, inadequate compensatory insulin secretion response, and tissue insulin resistance. When the body resists the insulin caused by unhealthy lifestyles, that makes the intraperitoneal cavity full of visceral fat, and the endocrine organ secretes inflammatory mediators, adipokines, and free fatty acids. The risk factors of type 2 diabetes mellitus are genes, lifestyle, obesity, age, high blood pressure, low level of HDL, etc. Diabetes is a complex condition, so a doctor may not predict the life expectancy. The range of estimated life expectancies is wide depending on the person's age, lifestyle factors, and treatments. There are several types of therapy and main oral anti-hyperglycemic agent drugs used by elderly type 2 diabetes mellitus patients, such as insulin therapy, metformin, sulfonylureas, thiazolidinediones, GLP-1 receptor agonist, DPP-4 inhibitors, and SGLT2 inhibitors. When giving medication to geriatrics, the adherence needs to be considered. Some ways to improve medication adherence are health literacy and patient monitoring. I think that's all from us today. Thank you for your attention, and we are very sorry for our mistakes. Thank you.